Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. The research I'm citing today was published in a major cardiology journal out of Spain in 2008. And I'm citing this paper because it's a brilliant summary of how best to prevent heart attack, stroke, heart failure, and other cardiovascular problems, which are leading killers in our society today. So the first thing to point out is that 75% of the incidence of cardiovascular disease, like heart attack and stroke and so on, is associated with four main risk factors. So what are they? Smoking, diabetes, and to some degree prediabetes, high blood pressure, also known as hypertension, and high cholesterol. So with respect to diabetes, diabetics have a 2 to 3 times greater risk of having cardiovascular disease and dying from a heart attack than non-diabetics. So they really have to be vigilant about keeping their cholesterol and blood pressure and other risk factors into the safest range possible. With respect to smoking, it's strongly linked to increased risk of cardiovascular disease, heart attacks. This was first recognized back in the 1960s. This is not a surprise to anyone. With respect to high blood pressure, it's a major risk factor. The use of high blood pressure medication has been associated with a 35 to 40% reduction in stroke incidence, a 20 to 25% reduction in heart attacks, and more than a 50% reduction in heart failure. So people with high blood pressure who don't get their blood pressure down are really gambling. You need to get your blood pressure down, and blood pressure lowering drugs can do that. Now, there are lifestyle things that can also be very important to getting your blood pressure down. So these would be losing weight if you're overweight, regular aerobic exercise, reducing alcohol and salt intake, and also things like meditation and progressive relaxation can also be very helpful. Now, 75% of people with high blood pressure, their pressure is in the mild to moderate range, and often lifestyle alone can bring their blood pressure down. But if it can't, then medication is vitally important. So with high cholesterol now, we know that high cholesterol is a risk factor for cardiovascular disease. It's very well documented that it is. It's not the only risk factor, but it's an important one. So to understand it better, it's the bad cholesterol, the LDL cholesterol, that deposits cholesterol into the artery wall, which then narrows the arteries progressively and blocks blood flow. This is called atherosclerosis. But the good cholesterol, the HDL cholesterol, can actually remove some of that cholesterol from the artery wall, open the artery wall up, and sort of reverse atherosclerosis. So that's the good news, is that you can reverse it to some degree. As such, having a high HDL cholesterol and a low LDL cholesterol is highly protective against cardiovascular disease. The longtime director of the very famous Framingham Heart Study, Dr. William Castelli, medical doctor, is the researcher who best showed us, including through his own personal example, of how to lower high cholesterol using lifestyle approach alone. And it's very simple. You simply reduce the intake of foods high in saturated fat and trans fats, and that tells the body to turn off excess cholesterol production and brings your cholesterol down. So, all these high animal fat foods, beef and pork and steak and butter and cheese and cream, and all these high saturated fat foods and deep fried foods turn on cholesterol production. Well, you can turn it off if you keep those foods out of your diet. I've seen it repeatedly with patients in my own practice and with my own experience. Now, to raise your HDL cholesterol, you simply lose some weight if you're overweight, and do aerobic exercise 5 times a week for 30 minutes, and your HDL tends to go up. So Dr. Castelli himself reduced his own total cholesterol from 270 milligrams per deciliter, which is a very high risk for heart attack, down to under 200 milligrams per deciliter, just making dietary changes alone. Then he increased his HDL by adding endurance exercise, aerobic exercise, and his HDL shot up from 49 to 63 milligrams per deciliter. Now those numbers reflect a major reduction in cardiovascular disease risk. Now with respect to Canadian units, this would be a total cholesterol change from 6.9, which is sky high. Most doctors would put you on medication at 6.9. And he got it down to under 5 point. He got it down to 5.18, which is considered to be fairly safe. Now, many doctors would automatically put a patient on cholesterol-lowering medication if they saw total cholesterol of 6.9 or 270 milligrams per deciliter. But Dr. Castelli got his cholesterol down through dietary changes alone. Now, in Canadian units, his HDL was originally 1.27 millimoles per liter, which is quite acceptable, but with exercise it shot up to over 1.6, which is highly protective. As Dr. Castelli stated back in 1994 during an interview with the New York Times, he was the first male in his family to make it to age 45 years old without coronary symptoms of angina or a heart attack. So despite being born with major genetic risk factors for high cholesterol and heart disease, he was able to reduce his own cholesterol and got it down into an acceptable range using diet and exercise alone, as he reported during that interview when he was age 62. So Dr. Castelli explained that 75% of people at least can get their blood cholesterol into the ideal range just with diet and exercise alone. For people with severe genetic risk factors for high cholesterol who can't lower their cholesterol through diet and exercise alone, then drug therapy is highly effective. As pointed out by the Physicians Committee for Responsible Nutrition, here's what they said. In decades of research, not a single person in the Framingham Heart Study with a cholesterol level below 150 milligrams per deciliter had a heart attack. So your best target to reduce heart attack risk is a total blood cholesterol below 150 milligrams per deciliter or 3.9 millimoles per liter. No one seems to have a heart attack when you get your blood cholesterol into that range. Now, regarding LDL cholesterol, and considering the data from observational and experimental studies, it's been estimated that the benefits of reducing serum cholesterol for heart disease risk are age-related. So a reduction of 10% in your serum cholesterol produces a decline in heart disease risk by 50% at age 40, 40% at age 50, 30% at age 60, and 20% at age 70. Now, it's estimated that every 1 milligram per deciliter increase in your HDL level is associated with a decrease in coronary risk of 2% in men and 3% in women. So modern research shows us that there are now additional risk factors for cardiovascular disease, such as C-reactive protein and high fibrinogen, high homocysteine, and a few others. But smoking, diabetes, high blood pressure, and high cholesterol are the four main risk factors originally identified by Dr. William Castelli and other Framingham heart disease researchers. They have stood the test of time. It's important to make sure you get your values for these into the ideal range and hopefully quit smoking if you are currently a smoker. Now, I've included a link to the cardiology journal below, along with a link to the 1994 New York Times interview with Dr. William Castelli. It's a very worthwhile read. So thanks for watching, and I'll see you next time.